go through it, there's a lot of paperwork to start with consent forms, getting a full background history, and we have to develop a treatment plan. So the first session is a lot of paperwork, and then we sort of get past that and start working on what the issues are, and try to, or you have a lot to do with what the treatment plan is, how often people are going to meet, what the goals are we're going to work on. Everybody who gets involved with mental health or with children's unit has to see a doctor one time, whether you need medication or don't need medication. Just to make sure that we listen. So everybody sees it, and we have 3 child psychiatrists. All they do is see children. So they have a lot of knowledge. They're very good students.
Actually, there's a NAMI meeting at Oakland Avenue Presbyterian Church next month, March 13th at 7 o'clock. And Dr. Coleman is actually, it's been a long time since we've had a psychiatrist at one of our meetings, and he's going to be talking about children's mental health. So if you want to come, I have some sheets here, and you can just remember to come. It's open to the public. We can open it up now for questions. Anybody have any questions or thoughts? And we'll be here a little bit afterwards, but we'd love to have some questions if you have anything on your mind.
Does your school-based counselors come out here to Clover?
Yes.
So would they come to this school? In particular, what schools do they go to?
Where there's a need, where
Where
we
there's a
actually
need?
have, yes.
Okay.
It's based on where we have students identified with a need, and we have a schedule set up.
Oh, okay,
Okay.
that's good.
That's great.
Our son did that, and that pretty much helped him stay in school.
Right, we had a
Because of-
school-based counselor in Fort Mill, and it was wonderful. It was wonderful, and they were great. They were great with him, and I know Clover's a great school. We're lucky. We all have. York County School District is a very, very strong school district in supporting their students.
I have a question. The over-anxious, of those anxiety disorders, the second one,
Uh-huh.
is that treated through therapy, discussion, or medicine? How is that treated?
It's actually both. It's actually both. Any of those anxiety disorders, the question was, those anxiety disorders, which are really the most prominent in children and adolescents, they are treated with medications, anti-anxiety medications, and some therapy.
And how long do you go before you say they're going to outgrow this, or no, they're not going to outgrow this? With that particularly, the anxiety disorders. I get that question a lot. When do I know to start looking into medicine?
Yeah. A lot of you're kind of on a continuum, and a lot of children who have some anxiety learn skills to how to manage it, and won't use medication unless they're in a major crisis of some kind. But there are some who, especially if you get into a lot of the obsessive compulsive things that they cannot control, and you try, because you're going to start counseling before you're going to start seeing a doctor. And we usually see folks
same things that our daughter did when she was under a lot of pressure, you know, they're gonna, if they have those anxiety issues, they are very often perfectionists, and they wanna be, they
Wants
wouldn't
to
want
do it his way.
Has to be right. Absolutely. Very strong-willed. And they're not going to be, they're going to come home and you're going to love them no matter what they do. So they're going to fall apart for you, and they're going to take out any frustration on you. And the tick that you might be seeing could be just a result of that anxiety. It's maybe you've reached a certain point where that happens. And it could be that something like that, you know, and I'm not a doctor, but they might say there's an anxiety medication that you can have with PRN as needed. So if you see that he's reached that level and you know that that might help him calm down and not tick or whatever, because, you know,
Usually it passes though.
how long?
And
Okay.
it passes sooner now that I've noticed this year.
Mm-hmm.
But in first grade, there was a few months that would go by before it would even pass. And the kids would make fun of him, and of course we'd have to step in
Right.
and say he can't control it.
Right.
And he has some sensory issues as well, like the Wilkins twins.
Right. Well, and you know, I think that'll be your call to just decide what you know, what might give him peace, what might not. And as he's getting older, you said they're becoming less frequent. So
Yeah, but the defiance is still. He
A lot of
wants to do
times-
it his way. You can't, if you try and show him how to do something, and it's not the way he wants to do it, it's a fight.
I'm not surprised. A lot of times when we are feeling out of control, we want to control everything around us. And I think the kids get more control when they are feeling out of control. It's just kids, but children do that.
You know, I just want to say one thing. Betsy and I teach this course that goes through all these, and we don't diagnose anybody, you know. I mean, it could be obsessive compulsive. I mean, there are all these different things. Maybe something that he wants, you know, he wants it this way because he's obsessive compulsive, or it's maybe anxiety disorder. I mean, that's where you need a professional to come in to really diagnose. And
Right.
even our
Yeah.
son never got a real I don't even know whether he's got a set diagnosis now, and he's
Right.
23,
They're kind of-
24 years old. I mean, his
They
diagnosis has
change.
gone all
They
over the
change.
place. You know what I mean?
Yeah, they do. I've noticed that the doctors have all different opinions on that.
Yeah.
The question is, the child is ADHD on medication, everything's going really well. How long will they be on this medication? Will they ever outgrow this? My answer to you, the way I understand all the information from the National Institute of Mental Health is, if they have these disorders, they are with them pretty much always. There will be ways, and again, there's this spectrum. I mean, he may have this much ADHD versus someone you see that can't sit still. I mean, not everybody has the same, you know, that same level of a disorder. There are lots of folks who, as they age, they have figured out, you know what, I'm ADHD and I'm not gonna be able to sit at a desk, so I'm gonna work outside. I'm not gonna need to take my medication because I have kind of provided myself with an environment that doesn't keep me, you know, kind of wrapped so tight. Instead of taking stimulant medication, they may have this huge cup of coffee in the morning and they may be just all set because that's a stimulant. I mean, you know, so there are ways that folks, they manage to cope with different, they manage to come up with some coping mechanisms. May or may not need medication depending on how severe it is. And you know what, they'll know if they feel better when they take medication as an adult or not.
Two kids that they both been diagnosed, one with ADD and one with ADHD, just recently. And I'm still not overly sure that I should medicate them. I actually, especially the one with ADHD, because he's more hyperactive. He's the one who
I have a recommendation for a book for some of you. His name is Dr. Ross Green, and he wrote the book The Explosive Child and Lost at School. And, you're reading these books and you're like, oh, this is my child, how did he know that my child? Your child is like in the book. But it's really some good insight and it's some good advice on what to do. But you have to feel comfortable with whatever it is you do. And I told you the story about how I was not comfortable with this medication, but the test absolutely screamed that he was really high on the spectrum. And I felt like, I should let me see if this will give him peace. And then another thing I knew was the medication they were prescribing, because I did all this research, he was going to have it in his system for 4 hours. And I thought, I can do this. For 4 hours, it's not like something that's going to be, it's not going to be in his system for that long. I'll see what's going to happen, and I'll know. I'll be able to make a better assessment myself. But that was just me. Yes.
I know we've got to respect time, and you may have other questions and want to stay after, but some of you may need to leave. But I do want to ask one last question
Sure.
out loud for everybody. What if you don't have insurance, but you want to see someone? How do you do that?
The question was, if you don't have insurance, how do you do that? I know that Catawba has a sliding scale fee schedule for families, and I think it's very, very reasonable. There are also some free clinics. I know that Dr. Mark Edwards actually works at a free clinic in Rock Hill, and she's a pediatrician, and I think they meet at
The Resource Center.
the Resource Center, Parent Smart on Fridays, and I don't know whether it's
And we have that here in Clover as well. We
Okay,
have a
then.
physician who comes to our resource center at the old Clover Middle School, and we have a doctor who comes for free once a week, and anyone can make an appointment there. It's a
And that would
pediatrician.
be a good place to start. That'd be a really good place to start without insurance. Well, thank you all, and we'll be here for a little bit if anybody has any questions. Oh, yes. We have a little drawing for all of you. Thank you.
Oh, I win.
What is
I
it?
automatically
Oh,
win.
the door prize is